Good afternoon. I want to take a moment to thank my next guest. This is Dr. Nancy Johnson. Nancy, good to see you this afternoon.
Good to see you, Karen.
Thank you for taking the time out of your busy schedule to meet with me, and what a great opportunity to let people know what's happening in our community. So, Dr. Johnson, you have a private practice in Cordova, and how long have you been in private practice?
I've been in private practice since 2008.
Wow, that's a good long time.
Mm-hmm.
Wonderful. And what types of conditions do you work with the most, as far as what do you specialize in?
I like to think I specialize in working with people that have trauma-based disorders.
Okay.
So whether that trauma-based disorder is anxiety, eating disorders, addiction, I really enjoy the underlying trauma piece of working with folks.
Wonderful. And what modalities do you utilize the most, would you say, to treat trauma?
There's probably a few things that I use, a smidge of this, a smidge of that. Sometimes I use some IFS language to talk about parts so that people may get a better understanding. I am EMDR trained, and I really try to use as many experiential techniques as possible when seeing clients live.
Okay. Well, you mentioned live, so let's talk about that. What are you seeing as the differences between in-office counseling and telehealth since the pandemic?
You know, it's interesting because I really did think that the webcam telehealth was really just going to be so flat and not very helpful at all. But I think it has been helpful because I think most of us are struggling with survival, and just feeling like, you know, you have somebody that's on the other end that you can connect to and talk about how you're getting through this, I think has been really helpful. I do think that probably it makes it a little bit harder to get to some of the deeper things that, you know, we like to work on with clients. But I think that for right now, I think most people are kind of in survival mode, and that's what they need right now, is just some of that real common sense connection and reminding to take care of themselves and checking in on them and seeing how they're doing.
I love that. Common sense connection. That's excellent. Wonderful. Okay, and are you seeing an increase in certain conditions as a result of the pandemic?
I think what I'm seeing is that I'm seeing a couple of things. One thing I'm seeing is that some of my clients who have PTSD are really doing well during this time. They have already sort of been isolative and they kind of live in survival mode. And so this has not really been that much different. Some of my clients who maybe struggle more with rumination, they are struggling a little bit more because they are worried about all of the other people in their life and how they're going to sort of protect them and make sure that they're safe and healthy, especially if they have older parents or family members. That's been a big concern for a lot of my clients.
I can see that. That makes a lot of sense. Okay. So one of the things that we talked about before we began recording was your love and your joy of providing supervision for clinicians. So tell me about that.
So I started doing supervision probably about 4 years ago. I started really looking into supervising temporary licensees or people who are looking at getting licensed. I currently have 12 supervisees right now. I'm supervising several clinicians who are working in an eating disorder program and a few others, and I have really enjoyed it. I really like that mentoring role, and I really like helping, especially new clinicians, maybe not have to go through some of the things that I went through as a new clinician and maybe didn't have as many options or opportunities for mentorship. So that has been really nice, and it's been really helpful, especially during the pandemic, because being a new clinician and having a pandemic, kind of a lot to deal with.
I can only imagine. Absolutely. Let's see, there was something else. Oh, I guess my next question then would be, what drives you? What brought you to this field?
I sometimes ask myself that question, Karen. But this is the easy answer, and the only way I know to say this. I have loved just the craft of psychology, the mystery of psychology, since I was in high school. I started reading Erickson, Burns, a lot of those sort of new frontier people at the time. And I just fell in love with the idea of learning about how people work, why they do the things they do. It's sort of like being a detective sometimes.
It is. I totally agree. That's wonderful. Well, is there anything else that you wanted to mention before we wrapped up?
Um, Not too much. I know that, this has been a great opportunity for people just to sort of talk about who they are and demystify the idea of mental health. And I think that's awesome because I know that, a lot of my supervisees, they're kind of trying to figure this out themselves, but it's so helpful to know that it's not some big mystical, magical relationship. It's really about helping people learn to cope more, how to identify some of the barriers they have that keep them from living the life they want to live. And so it's really, I think, nice that you're opening this door so that people can maybe have a better feel for that.
Well, great. I appreciate you saying that. That's something that I was hoping to do. And you can certainly let your supervisees know that I'm more than happy to promote what they're doing as well.
Cool. Love it.
Well, thanks again for your time, and I look forward to seeing you soon, if at all possible. Actually, in person would be nice.
I know I miss your visits.
Well, I certainly miss seeing you. Take care, and we'll
Thanks.
talk soon.
Good to see you.